Welcome to Unpacking a Diagnosis, a layman's guide to healthcare. Just a quick disclaimer, I am not a doctor or a medical professional of any kind. I'm an average person who has spent years navigating my own complex medical issues. The goal of this podcast is to help you gain medical literacy and to better understand various medical conditions. The information provided is not intended to replace the recommendations of your personal care team. On this episode, we are going to discuss the cervical spine and ACDF, or Anterior Cervical Discectomy and Fusion Surgery. According to Cleveland Clinic, approximately 130,000 people in the U.S. have this procedure every year. I had this procedure performed on me in April of 2021, and my surgery was the fifth that my surgeon was performing that day alone. My personal experience will be the subject of a future episode. For now, let's discuss the cervical spine itself and better understand the anatomy before we discuss the procedure. When we are talking about the cervical spine, we are talking about a section of your spine that makes up your neck. The cervical spine consists of the first 7 vertebrae of your spine, which extends from the base of your skull to approximately where your shoulders begin. If you imagine a Halloween skeleton, the vertebrae are the spinal bones, and each one is separated by an intervertebral disc, which is a spongy spacer with a gelatinous center. I've heard surgeons say that the texture of this disc is kind of similar to crab meat, which is kind of gross, but I digress. The purpose of the intervertebral disc is to provide flexibility to the spine and act as a shock absorber between the vertebral bones. Our spinal cord itself runs from the base of our skull down into our lower back, and it's contained within a canal that's passing through these vertebral bones. Our spinal cord is responsible for sending signals back and forth between our brain and the rest of our body. These signals control everything from the beating of our heart to pushing the air in and out of our lungs, movement throughout our bodies, and how we sense the world around us. So it's really critical stuff. If you're a more visual type, you can check links in the show notes, which I'll have some images of the cervical spine. So what is ACDF? ACDF stands for Anterior Cervical Discectomy and Fusion. Anterior means the front, cervical describes the section of the spine, discectomy literally means the removal of the disc, and fusion is fusing the vertebrae together to create a stable section of spine. The ACDF is considered to be a minimally invasive surgical procedure which is used to treat issues of the cervical spine. We will get into some of those issues in just a moment, but first let's describe the procedure itself. At the start of the procedure, you'll be placed under general anesthesia. The surgeon will make a small incision about 1 inch in length off-center on the front of your neck in an area approximately above your collarbone. Through this incision, the surgeon is going to remove the intervertebral disc and replace it with an appropriately sized spacer, which will maintain the proper spacing between your vertebrae. Then, a titanium plate is placed on the spine and screws are driven in to stabilize that section of the spine. During your recovery period, bone growth will fuse to the intervertebral spacers and create one solid section of spine. Recovery instructions tend to vary by surgeon. Some surgeons prescribe a hard collar for a period of time, while other surgeons oppose even using a soft collar. Some surgeons want physical therapy to begin within the first couple of weeks following your surgery, while others might want you to wait several months before starting physical therapy. The key here is to trust your care team and realize that their personal recommendations are actually based on their outcomes that they've witnessed through their years of experience. So trust your care team. If you don't trust your care team, you might want to pick a new one. So when does somebody undergo an ACDF procedure? Typically, an ACDF is performed when conservative treatments have failed, and the risk of not getting the procedure is greater than the risk of the procedure itself. So let's say you're at the point now where your doctor is recommending that you get the ACDF, and they're throwing around terms like herniated discs, degenerative disc disease, spinal stenosis, spondylosis. What do all of these terms mean? Let's start with the term spinal stenosis. Spinal stenosis means a narrowing of the spinal canal. This narrowing can put pressure on the spinal cord, on the nerve roots, and it can result in pain, tingling, weakness, and a host of other symptoms. The cause of this narrowing is typically a herniated disc. A herniated disc occurs when the disc itself bulges out into the spinal canal and puts pressure on the nerve roots or the spinal cord itself. Another cause for this narrowing is just degenerative changes that occur as we age. As we get older, our discs will start to lose height, which will cause a narrowing in the spinal canal and the areas where our nerves exit our spine. The term spondylosis describes a lot of these age-related degenerative changes, and you could kind of think of spondylosis as being synonymous with arthritis. If your doctor is recommending that you get this procedure, it's probably for a very good reason, as most surgeons will try to exhaust every conservative treatment possible before recommending surgery. The only advice I can provide is to get multiple opinions. Visit several doctors, ask a lot of questions, and go into this procedure as informed as possible. If you have questions about the show, you can email me at unpackdx@gmail.com. Thank you for listening, and I hope you listen to the next episode.